Merkley from Oregon and Republican Senator Roger Wicker from Mississippi. Good morning, gentlemen. Great to see you both. Thank you for taking the time. Senator Merkley, your colleague, Senator Wyden in Oregon, said the following. He said the legislation is heavy on health and light on reform. Would you agree? Is the pending legislation in the Senate just that?
Well, there's a tremendous amount of reform in the bill. One is to invest in prevention, another is to invest in disease management, another is to fund healthy choice incentives that have been used very effectively in private companies, and certainly the concept of introducing a public option which would return competitiveness to the healthcare marketplace is certainly a big piece of a very strong reform.
Senator Wicker, we've heard things like opt-out options for the states. We've heard about trigger options. We've heard about fallbacks. I've never heard so many words used for a second option. Will you support those if it's not a public option?
Well, no. The easy answer to that is no. I don't want to support anything that has a government-run insurance company in fact, competing with the private sector. I don't know why we don't actually try for the first time to move to honest-to-goodness competition in healthcare. We haven't allowed insurance companies to compete across state lines. We should do that. We haven't allowed small businesses to band together in association health plans to protect their purchasing power. We ought to try those things. That's what works in America. It's what's historically worked, to bring down cost and to make companies of whatever kind, including insurance companies, more responsible and more responsive to the consumer.
Senator Merkley, it's a very valid point. Is a health insurance exchange enough competition, or do we really need to look at selling insurance across state lines?
Actually, what an exchange does is it creates the opportunity to move companies into new markets. Health insurance, unlike life insurance, it's very hard to go into a new market because you have to set up contracts with all the providers. By having an exchange where a provider can go and know that they're going to be in front of hundreds of thousands or millions of individuals, it makes it much easier for a company, say, to move from Northern California into Oregon. It increases competition. It makes competition possible in a way that the existing system certainly has not.
So does that mean, Senator Merkley, that given what we have right now, you support the pieces of legislation that the Senate passed in the Finance and the Health Committees?
Well, I certainly support the piece of legislation that the Health Committee passed. I serve on that committee. I think it was well done. There's going to take a lot of adjustment. We're going to see what comes out of the merger that the majority leader is putting together. And we're going to have a long, intense floor debate over the components. But it is my belief we have come so far. Momentum is so important here. We have 5 committees that passed out bills. We now have a bill that's passed through the House. We have a historic opportunity, a generational opportunity to have affordable, accessible health care, quality health care for every American. We cannot let this opportunity slip through our fingers.
Senator Wicker, there is a great deal of debate about Medicare, whether or not we need to set reimbursement rates. What are we doing to the Medicare program? Because it appears as though we're going to fund this through Medicare, and Medicare already has some of its own issues.
Well, actually, the proposal, whether you talk about the Senate version or the House version, provides for cuts of $400 billion over a 10-year period in the Medicare program. And it's not just Republicans saying this now. Democrat after Democrat on the House floor last week pointed out the problems that this would have for Medicare Advantage, which many of our constituents depend on, for rural health care. When you start cutting reimbursement to providers, you threaten rural health care and you threaten the viability of hospitals in many sections of the country. So regardless of which approach we take, at the bottom line, we're going to have $400 billion of reductions in Medicare. We're going to have huge Medicaid mandates on the states, and almost every governor you talk to says, how's my state supposed to pay for this new mandate? Mm-hmm. It's going to be paid for by increased state taxes on the people of those states and on the American people as a whole. And then on top of that, this vast expansion of the federal government. We now know that the House bill is actually $3 trillion in cost when it's fully implemented. This is not the time, with 10% unemployment,
right,
with a deficit of $1.4 trillion in 1 year alone,
right,
for us to be expanding the federal government in this new entitlement program.
Senator Merkley, we talked earlier, you're on the Health Care Committee. You need 60 votes to get this passed. There's 2 independents. Senator Joe Lieberman, after the House bill passed on Saturday, said a bill like this with a public option will not appear on the Senate floor. Senator Lindsey Graham said it is dead on arrival. How are you going to get the 60 votes needed?
Well, there's no bill that's going to be dead on arrival after the majority leader puts the 2 pieces together, because we're all anticipating that we will have several weeks to wrestle over many of the points, including the source of funding. But let me just expand a little bit on what my colleague said. Where he said this is not the time, I can only reply, this is the time. Because small businesses, which are the factory of jobs in our nation, are really suffering on the current 15 to 20% tax, if you will, the additional amount they pay by not being part of a large pool. And as they drop insurance, we have an insurance death cycle. We have more uninsured today than we had 5 years ago. And as prices increase, those who go to the emergency room transfer those prices. It drives health care further up, and more employers are dropping their insurance. Furthermore, our big companies cannot compete internationally under the current system.
Right.
We need to put America back on track, and part of that is making our health care system far better for our citizens, but far better for our businesses.
Gentlemen, yes or no, will health care bill pass by the end of the year? Senator Wicker?
I think more and more American people are doubtful about this. The poll last week, first time a majority of the American people, 53% said need to go slow on this. We need a step-by-step approach.
Senator Merkley,
I do
yes
not think
or no?
it will pass before the end of the year.
It'll be in conference and probably out of conference and on the president's desk.
All right, gentlemen, thank you very much. Good seeing you both this morning. We appreciate it. We'll be right back in just a moment with more on the opening bell.
If you're an investor, you need to listen to this.